Your heart is probably the most incredible muscle in your body. Think about it. It beats over 100,000 times a day, every single day with no breaks. It's just this amazing engine. But what happens when that engine, that perfectly engineered pump, starts to get overwhelmed by the pressure? Well, that's what we're going to dive into. So what does happen when this powerhouse muscle just can't keep up with what our body needs? When the amount of fresh, oxygenated blood it's pushing out just isn't enough anymore? Well, you get a really serious condition called congestive heart failure. The whole system gets so backed up that fluid starts to spill over, and it affects millions and millions of people all over the world. So in this explainer, we're going to break it all down. First, we'll define what the problem actually is. Then, we'll look at the two main ways a heart can fail. We'll get into the root causes, cover how doctors diagnose it, and finally, talk about how this condition is managed today. All right, first up, let's really define the problem. What does it actually mean for a heart to be overwhelmed? Okay, it is so important to get this straight from the get-go. Heart failure is not a heart attack. It's not some sudden, dramatic event. It's a chronic condition that gets worse over time. Simply put, it's when the heart just can't pump enough blood to meet the body's needs. The pump is still chugging along, but it's failing at its most basic and important job. So why do we call it congestive heart failure? Well, because the failing pump creates this massive system-wide traffic jam. Blood starts backing up into the lungs, that's the congestion. Then fluid starts leaking out and building up in other places, like your legs and your belly. And because of all this, your organs aren't getting enough oxygen, which is exactly why people feel so breathless and exhausted. Now, here's where it gets really interesting. Heart failure isn't just one thing. It's actually categorized based on which part of the heart is failing and how it's failing to do its job. First, we can classify it by which side is giving out. Think of your heart as a two-part pump working together. In left-sided failure, the powerful left ventricle can't push blood out to the rest of the body. So where does it go? It backs up into the lungs. That causes fluid buildup and that classic shortness of breath. Now, often, that pressure from the left side eventually overwhelms the right side, causing right-sided failure. Now, the right ventricle can't pump blood to the lungs, so fluid backs up everywhere else in the body, which is why you see swelling in the legs and abdomen. The other way we classify it is by function. Is it a squeezing problem or a filling problem? In systolic failure, the heart muscle itself is just too weak to contract with enough force. This is your classic weak pump problem. We measure this weakness with something called an ejection fraction, and in this case, it's reduced. But in diastolic failure, the muscle is actually strong, but it's become stiff. It can't relax properly to fill up with blood in the first place. So even though the squeeze is fine, there's not enough blood getting in to begin with. That's why we call it heart failure with preserved ejection fraction, two totally different mechanical problems. So, all of this leads to the next big question. Why does the pump weaken or get stiff in the first place? Well, the root causes are often things that have been going on for years. You see, heart failure is almost always the end result of long-term damage from other health issues. The number one culprit is coronary artery disease, where clogged arteries mean the heart muscle itself isn't getting enough blood. Another huge one is high blood pressure, or hypertension. It just forces the heart to work way too hard for years and years until it just gets worn out. Other causes can be diseases of the heart muscle itself, what we call cardiomyopathies, or even faulty heart valves. And here's the really cruel, ironic part of heart failure. When the heart's output drops, the body panics. Its ancient survival instincts kick in. It floods the system with hormones to make the heart beat faster and to hold on to salt and water, all in a desperate attempt to get blood pressure back up. But these short-term fixes are a total disaster in the long run. They force the already exhausted heart to work even harder, against more pressure and more fluid, creating this devastating vicious cycle that just makes everything worse. Okay, so because of that downward spiral, you can see why recognizing the signs and getting a diagnosis early on is so important. So what are we looking for? The symptoms are a direct result of that plumbing backup we were just talking about. If you have left-sided failure, the traffic jam is in your lungs, so you get shortness of breath, especially when you're lying down. If you have right-sided failure, the backup is in the rest of your body, leading to things like swollen legs, a bloated belly, and even a jugular vein in the neck that you can see is bulging. Now, to confirm the diagnosis, doctors need some hard data. And a huge piece of the puzzle comes from a blood test for a hormone called BNP. You can think of it like a distress signal. When the heart's chambers are being stretched and strained by all that extra pressure and fluid, they release BNP. So a level above 125 is a really strong sign that the heart is struggling. Beyond the blood work, a chest X-ray can show if the heart looks enlarged or if there's fluid in the lungs. But the gold standard, the single most important test, is the echocardiogram. It's basically an ultrasound of the heart that lets doctors watch the pump in action, measure how well it's squeezing, and spot any structural problems. All right, now for the most important part, and it's good news. While heart failure is a really serious diagnosis, it is absolutely a treatable condition. The goals are to reduce symptoms, improve quality of life, and most importantly, slam the brakes on that vicious cycle to slow the disease down. The foundation of treatment actually starts with the patient. These might seem like simple lifestyle changes, but they are incredibly powerful. Cutting back on salt helps reduce all that fluid buildup. Weighing yourself every day helps you catch fluid gain early. And getting regular, appropriate exercise can help strengthen not just your body, but your heart too. But the real revolution in treatment has come from medications. Now, diuretics, or water pills, are great for managing symptoms by getting rid of excess fluid. But the cornerstone of therapy today is a cocktail of drugs that directly fight back against the body's harmful backup systems. Medications like ACE inhibitors and beta blockers actually block those damaging hormones we talked about, which takes a huge load off the heart. These drugs don't just make you feel better, they've been proven to help the heart actually heal and improve its function, and they dramatically reduce mortality. And for patients with more advanced heart failure, technology can step in. Devices like implantable defibrillators can protect against life-threatening heart rhythms, while amazing little pumps called ventricular assist devices, or VADs, can actually be implanted to help take over the work of the failing heart. And this right here is really the key takeaway. A diagnosis of congestive heart failure is, of course, incredibly serious, but it is not a death sentence. With the right mix of lifestyle changes, modern medicines, and advanced therapies, people can and do live longer, fuller lives. So this all leaves us with one final crucial question. When you think about it, heart failure is often the end result of decades of strain from things like our diet, stress, and uncontrolled blood pressure. So the real question isn't just how do we treat it, it's how do we prevent it in the first place? What's one change you can make today to lighten the load on your body's most vital and most vulnerable pump?